Hi everyone, it's Sue Fox. I wanted to just briefly go over with everyone today how to correctly set our pump to the therapy mode for IV titratable medications. I know that some people had said that they were having issues with it, so I just wanted to kind of show you up close and personal how to do it. So this is our patient here, Mr. Jones, and Mr. Jones already has his IV in place. We have already hung a bag of saline. I put it on a roller clamp tubing, and I put that right to Mr. Jones's IV site here as his primary line. However, it is clamped off, so it's not going to be running. And then on the pump, we have our medication that we've hung, okay? And I'm going to show you how to properly set it. For today, we'll say that we're going to do dopamine. We'll go with that. This line I actually have taken and I put it, what I want to do with this medication line, where is my line, is once I have my main line hooked up on the roller clamp, I would take this line, obviously I'm going to use my alcohol swab to swab it off, and I'm going to connect this to the lowest port of this line, or with these Nextivas, you can do it to the second port here, like this is a Y connection, you could put it here. So either way, you're covered. God forbid something goes wrong with the medication and you need to stop it, you could always just open up your roller clamp of saline. Like say you had nitro running and the patient bottomed out, his blood pressure bottomed out, you could open up the roller clamp and give him a nice bolus. Okay, so that's why we do it that way. So now onto the pump. One of the first things I want to say though is anytime you're hanging a titratable medication, we should be using the chart that is in this critical drug book. They are located on top of the crash carts in both Dover and Denville, and I believe there is one in Sussex as well. And inside the book, particularly this white chart. This chart comes from the pharmacy, okay? It's laminated. In the book, it's a front and back chart. It lists all of the medications that we titrate. But if you, God forbid, couldn't find this book or couldn't find this chart, the chart is also attached to the titratable IV medication policy located in the Medication Management Policy and Procedure Manual on the intranet. It's on the back of the policy, okay? So if you're in doubt, you can always just pull the policy. Okay, so I'm going to come here, and I believe we said we were going to do dopamine. So I'm going to find my dopamine on my list here. And also, too, just so you guys know, Cardine is not in this pump drug library. We did find that out. Okay, so dopamine is here. So when you get your order placed by the physician, first thing also that you want to do, another thing that you want to do, obviously, is go to the MAR, make sure that the order is correct. You should have a start dose, an end dose, a parameter for the patient, depending on what kind of medication that is. It could be a blood pressure parameter, it could be a Ramsey scale, it could be a heart rate parameter, depending on what kind of med. And you also want to make sure that your concentrations are correct. So for instance, for dopamine, in the book here, it's a 400 milligram and a 250 ml vial. That's what we have in the Omnicell. They're telling you that the final concentration is 1.6 milligrams per ml. And the recommended starting dose, 2.5 micrograms per kilogram per minute, with a recommended high dose of 20 micrograms per kilogram per minute. That's a max dose. So when you look at the order in the MAR, you want to make sure you have your starting dose and your max dose. And then on this chart, what's nice is it tells you how to titrate it. So for dopamine, it's titrate by 5 mics per kg per minute every 10 minutes until you reach your desired effect. Okay, so now, I don't know, are you able to zoom in a little bit on the pump? I'm going to turn your pump on. Okay. Okay, so when you're ready to set your therapy, you're going to obviously go to the A, right? Because this is our A line, our primary line. And there's a button here called therapy, okay? Hit your therapy button. Now you're going to get a list of available medications in the pump, okay? So you could either use these arrows and go down one by one, or you can do page up and page down. So we're looking for dopamine, so we'll hit the page down. Oops. And here's your dopamine. Now we'll just arrow down to that one. Okay. Now you're going to hit enter. Dose calculation, choose. Okay, so we know we want micrograms per kilogram per minute. We know that's what we're looking for. We hit choose. The dose concentration in the vial we know is milligrams, right? It was 400 milligrams in 250 ml, so we are going to go with milligrams on that. Choose. And this defaults to a lot of what it should be. If you ever notice that it's not defaulting to the wrong thing, obviously you can change it, but the machine is pretty intuitive with that. So the concentration again was 400 milligrams. And then if you hit the down arrow, it'll take you to the mLs, 250 mLs. Hit the down arrow again. We're going to say that our patient weighs 70 kilos. Okay. And your dose to start was 2.5. Let me just check that. Yep, 2.5 mics per kg per minute. And your volume to be infused is 250. So now you can see it's already calculated it for you. It knows that it's 6.6 mLs per hour for 2.5 mics per kg per minute. Okay? Now, at this point, if you hit start, it's going to come up with another screen that's going to show you, okay, are you pretty much sure that this is what you want to give? And at this point, I always recommend that you maybe have a second RN come in and just say, you know, can you just eyeball this for me and make sure that it's okay? Because sometimes, you know, we're rushing, we have a lot of patients in our section, things are going on, and, you know, God forbid anybody can transpose the numbers. So we have another nurse look and she says, oh, yep, that looks good to me. Once you hit yes, your infusion will start. At that point, if you now need, so say 10 minutes goes by and now you need to bump up your infusion, another 2.5 mics, you can always go back to A, okay? And it brings you right to where you need to enter your next dose. So then you can go to 5. And then you hit start again. And again, it's going to ask you, you sure? Yes, I'm sure. Oh, sorry. Yes. And now it brought it up to 5. Okay? Also remember to titrating up by 2.5 every 10 minutes. If you have to back down, if you have to come back down, say the patient, you know, has like the blood pressure is too high or too low, you know you have to back off the medication. You have to come back down by the same increments that you went up. So if you went up by 2.5, you have to come back down by 2.5. Okay, you can't come back down by 1 because you're trying to, like, you know, play the cards. And really, that's pretty much it. So thank you. And if anybody has any questions, come see me.